So we are actually monitoring patients at home every few hours through the initial phases of the taper. It really depends on the patient. It depends on how much they consume, when they typically, consume that, and what type of alcohol, like what potency. All of those things factor in terms of how we approach the taper. But those first few days in patients who are consuming very large amounts of alcohol can be more challenging. And so what we do is we have the nurses check in with them. They perform an assessment that's called the CWA assessment. It enables them to look at symptoms of withdrawal. And those symptoms can include things like tremor, agitation, anxiety. And if it's starting to move even further, it can get into hallucinations and other things. So we don't let it get there.
Sure.
We are tracking that patient frequently and tracking all of their symptoms. And then we also, every patient in their kit that we ship to them when they start our program, it has a blood pressure and heart rate monitor in it. So we're having them check their blood pressure and heart rate and report that to us each time. As the nurses are tracking that, if there's a change in their CWA score and we have to adjust the medications, then they're in touch with either the psychiatric nurse practitioner or myself or one of the other doctors to make sure that we can intervene with whatever medications we need. And we start the patients off with a certain set of meds at home so that we have things available to us to give them depending on their symptoms. If they're having trouble with sleep, we've got them on something for sleep. If they're having trouble with anxiety, we have something for them to have there as needed so that when anxiety creeps up, they have something available for them to take. And we can adjust some of the other medications that we use to relieve the symptoms of withdrawal. Gabapentin is a good example. We'll adjust the dose there, again, to sort of help bring those symptoms down. And then lastly, it's a taper, right? We're not taking people off abruptly. So if we've gone from 25 standard drinks a day, that's not uncommon, and someone's currently on 15 and they're starting to really have a lot of symptoms. So you're down to 15. Tomorrow we can go down to 13. The next day we can get down to 11.
Sure.
Even if it takes some time, that's okay. So we can withdraw this at a pace that's physiologically tolerable, and it doesn't put them at risk of seizure. And so they did a study on this in Australia, and they found that of 71,000 patients, the people who had gone through this, only 280 or so people had really severe withdrawal symptoms. You can manage this safely, for thousands and thousands of people if you do it the right way.